DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson. I'm tickled to death that you joined us today. We're going to talk about the #1 killer of beef cattle in the United States, bovine respiratory disease. And we're going to talk about how to treat cattle with bovine respiratory disease with Dr. Mike Apley from right here at Kansas State University. Stay tuned.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Well, Mike, welcome to the show.
Thanks.
Folks, this is Dr. Mike Apley. He's a friend and colleague here at Kansas State University's College of Veterinary Medicine. You know, we've done some things on the road with our Cowboy College and do a lot of work directly with feedlots, directly with our veterinarians and our vet students. And BRD is one of those things that has kind of been one of the things we've worked with a lot.
Main staple, yeah.
Yeah. So when we talk about bovine respiratory disease in beef cattle, you know, the big thing that the first thing we have to do is identify sick cattle out in the pen. And what are some of the things that you kind of coach on for picking up one that's not doing right?
Well, one of the things I encourage people to do is, you know, we need a protocol anymore. I think the days of not having written plans are really behind us, and it makes some people squirm, but it forces us to plan and really think about it. And I encourage people to write down what they're looking for, especially for training the next generation or new help. And they may even use a scoring system. Sometimes we use a 0 to 4, where 0's, hey, there's nothing wrong with this calf, 4 is it can't get up, and then we might argue a little bit about 1, 2, or 3 in the middle. But that's a training tool, because by arguing about how ill the animal really is or depressed, that forces us to talk about what we're seeing and then train and interchange about that. So we call it a case definition in veterinary medicine about which ones we'll actually treat, and it shouldn't be all of them in a pen situation. Obviously, we're going to, you know, unless we're applying treatment for control on arrival or something, but we're going in to pick out certain animals. And let's talk about the criteria that we're going to do: depression, how they move, and then we'll have secondary criteria when we get to the chute, and that includes maybe temperature or listening to them or a variety of different things. But that's our main, those two things put together.
And so when we talk about out in the pen, let's do our primary and then let's go through our secondary. But let's get out in the pen, you know, the old DART protocol is pretty hard to beat. But what are some of the things that you're having cowboys, pen riders, farmer feeders look for in identifying a calf that's sick?
Sometimes you got to adjust your dial on the way those cattle are behaving. Mm-hmm. You know, ones that are a little wilder might not allow you to see the illness as quick or as much, and so you have to be a little more tuned into them. Basically, depression, hanging out from the others, it really draws my eye when I go up to a group of calves and everyone moves away except 1 or 2, or some are slower. So really heavily on depression, how well they're eating. I'll sure let a sunken flank make me look over a calf, but I won't let a full belly talk me out of pulling one if I think they're really sick. Respiration rate, depends on the time of the day, as all our listeners would know, and how you evaluate that. But it's one that really stands out as different from the others. And the way they present to you may change in in the way they do that is they become more used to you and more comfortable with you and are not viewing you as a predator or a threat to them. So really standing out from others is one way.
Yeah, we're going to take a break, but the big thing, you know, is cattle are kind of like people. You have people that have a hangnail and they miss work for 2 weeks,
Yep.
and you got people that come to work every day with Ebola virus and blood coming out of their eyes, and cattle that get sick some of them you can identify real easy, and some of them blend in and won't let their
Right.
guard down. But when we come back, we're going to talk more with Dr. Apley about bovine respiratory disease, how to pick out those cattle, and how to treat them. You're watching DocTalk, and we're sure glad you joined us.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Holt Tripp, a Kentucky native, is a fourth-year student at Oklahoma State University Center for Veterinary Health Sciences. He is pursuing a dual DVM MBA program. After graduation, Holt hopes to own and operate a diversified research and consulting practice specializing in feedlot and stocker cattle production systems.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Calves require adequate, high-quality colostrum immediately following birth to receive the immune and nutritional support needed to fight diseases and thrive. Next-generation Colostrix colostrum replacer and supplement are USDA licensed to aid in the treatment of failure of passive transfer and contain natural maternal bovine colostrum antibodies against E. coli K99. Ask your animal health supplier for Colostrix or visit agrilabs.com for details. Colostrix makes all systems go.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Hey folks, welcome back to DocTalk. We're back with one of our regular guests, Dr. Mike Apley, and we're always tickled to death to have him break free from his busy schedule to come talk to us. Generally, it's about antibiotics or feedlot operations, and every once in a while we might let you talk about a pig, but not
today.
Not today. Today we're going to talk about bovine respiratory disease, and we've got the calf, found the sick one out in the pen, and now we've got them to shoot. And you have a secondary criteria that the doctors or cattle feeders are going to look at, and let's go through those.
Well, and I'd say we found one in the pen might be sick, and
Right.
that's the attitude we want to have to come in. Now, some places will say if they come out of the pen they're going to get treated. I prefer to apply some secondary criteria, and we can use temperature, rectal temperature, and one of the things to do is make sure you got a decent thermometer that's actually reading right. And sometimes we use water baths along with a calibrated thermometer, which may be beyond some of our producers watching to do that. But a good, high-quality thermometer. Invest in a good thermometer.
And our normal rectal temp is 1015 to 1035 in these feeder cattle.
Most of the time, and of course, hot afternoon, it's going to be higher. And but you usually use at least a 1035 to 104 cutoff.
Yep.
And there's going to be some exceptions to that, but if we just make a lot of exceptions, sometimes we end up treating a bunch that don't need to be treated. Another way that people are looking at is listening to the lungs and seeing.
Yeah, when you said it earlier, we're going to listen to the cattle, I was like,
listen to them talk to them.
Hear those little voices.
That's only late at night. It's called auscultation, but listening to their lungs and seeing if there's some sounds there that would direct us one way or the other with them. So there's some secondary criteria to apply in the chute, and you put that together with the fact they came out of the pen, and now you make the decision to treat or not treat.
Right. And sometimes you can adjust. I see some veterinarians adjust their treatment protocol based on primary and secondary criteria. I just, if one's sick, I have pretty much a criteria that this is what they're going to get, just trying to simplify things. But once you've made that decision, we've looked in the pen, we've identified the sick calves, we've brought them up, we've confirmed that the pull was running a high fever and the lungs don't sound very, we don't have good lung sounds. We've got to make a choice on an antibiotic. Mm-hmm. And we've got about a minute until we go to the break. So if we need to, we can go into the next segment and talk about this as well. But when it gets down to antibiotics, what are some of the big things you're thinking about?
I'm thinking about probably giving it to him just once. And then the big thing that's in my mind when I give an antibiotic is, when am I going to decide whether this animal's responded or not? After I've given this antibiotic, what's the period I'm going to allow for recovery? And then I'll have a plan for yes, no on that. But that's the main thing in my brain.
All right. So, I've read your myths. So, is there any good combination of antibiotics?
No.
Right.
I just give one. Yeah.
Just give one antibiotic and give it at the higher dose once rather than the lower doses consecutive days.
And then I go for the antibiotics that are single administration, and which is the majority of them we have now for respiratory disease.
Well, we're going to have to pick this up. Let's take a break and we'll come back. We're going to come back. We're going to talk a little bit more about antibiotics, and then we'll jump into some of the ancillary therapies, which might be an even shorter conversation with the good Dr. Apley. Thanks for joining us. See you here in a minute.
The BQA tip of the day, sponsored by Beringer Engelheim Vetmedica Inc.
I'm Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation. Today's tip, we're going to talk about accurate dosing of cattle as we process or work our cows and calves. It's very important that we dose them accurately. How many times do you set your automatic dosing gun for your wormer? Just set it on a flat 60 and process your cows. I would suggest or recognize that we actually ought to take a more accurate approach with the weight and dose it up and down accordingly. We could be overdosing, we could be underdosing. Underdosing, as we know, leads to resistance. Overdosing reduces efficiency. So the most accurate way is to bring them in the chute, have a scale head, collect a weight, and dose them accordingly. If you don't have a scale head, I would suggest that you could get one. I promise you it will pay for itself over time.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
True Test Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with my friend and colleague, Dr. Mike Apley, who is a veterinarian who specializes in feedlot medicine. He specializes in clinical pharmacology. And Mike, I'm just going to bullet list some things.
Okay, we can do that.
The first one is you know, I've heard people you want to use combination therapies, 2 antibiotics versus 1. If 1's good, 3's better. And what's your thoughts?
2 issues with that. Well, several, actually more than 2. One is, you know, can we justify the added cost and the added injection sites, et cetera? 2 is there anything at least publicly available I can access which would suggest that this improves response to therapy, and there just isn't. So I know we can increase costs, we can complicate things. I don't have evidence that increases efficacy. And the 4th is, if you pick the wrong combination, you can inactivate some of those. So for example, the beta-lactams, which include penicillins like penicillin G, cephalosporins like ceftiofur, which we have 3 versions of, those work with the cell wall dividing. So the cell wall has to be clicking along and dividing. So for example, when we have strep throat, those things are dividing every 20 minutes, so they're having to build new cell walls, and those are like slipping a fake brick in there, and they get built and they just crumble, so they die. But if you put in a drug that slows down the growth, like a tetracycline, then those can't work as well because it isn't growing as fast. So sometimes putting 2 things together isn't.
Yeah, and you've even shown me some of the papers in some of the pediatric pneumonia cases where we have decreased treatment response when we use combinations versus using the drugs individually.
Yeah, and you avoid all that by picking one drug. And the other thing is thinking you have to put something with it to get quicker action, and that's just not true either. So many of these things are peak concentration by 3 to 6 hours, and when it's a 6-hour peak concentration by 3, it's really close to it because it's a big gradual arc. So,
how about IV versus sub-Q? Intravenous injection, vein in it?
Vein in it.
Get it in there quick.
Yeah, anymore that's kind of more for show. I think our drugs we have today, even though they're single injection, they get to a pretty rapid concentration gradient. They get pretty quick.
So, and then the other one is single versus multiple treatments of an antibiotic.
I really like the single injection ones.
And the example is you know, given, let's just use Baytril as an example, 1 big dose of Baytril, the 6 ml per 100 one day versus 3 cc's per 100 3 days in a row.
Right. And you know, we learned something years ago, and back then it was the long-acting oxytetracycline against daily injections. And so they'd get a total of 9 milligrams per pound once with the single injection of the long-acting over 3 days, or they got 5 milligrams per pound every day for 3 days. So they got a total of 15 split up daily, and the 9 milligrams once beat the 15 given it every day. And part of that's just quit messing with them, give them the single injection.
I always say, if you have which one would you rather have? Go into the doctor's office 3 days in a row for a treatment, or get 1 dose? We got to take a break. When we come back, we're going to wrap up with BRD with Dr. Mike Apley. We're going to talk about ancillary therapy and some of the things on recovery. You're watching DocTalk, and we're sure glad you joined us.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
Hello folks, this is Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation out of Great Bend, Kansas. Today's BQA Tip of the Day, we're going to talk about lung scoring cattle and the newest tool we have available to us today to use to help us better identify the severity of respiratory disease in cattle is a stethoscope. For the last 50 years, the only 2 ways we've pulled and treated sick cattle is by visual observation, as well as then once they're in the chute, is using a thermometer to see what their temperature was. Up until a few years ago, we have never had a tool such as this to give us another tool to our toolbox to help us better identify the animal and the severity of the disease that they may have. It's very easy, works very well. You place the stethoscope right here, it records the lung sound, kicks it across to the computer, kicks out a lung score, as you can see up here, and then we can use that as part of our decision-making process and antibiotic selection for these sick animals. It's a great resource. It's the best thing we've had since a thermometer. Let's put it to use.
no matter where, no matter why. The Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Working your cattle just got easier. Introducing the new VetGun delivery system, a new way to apply topical insecticides to your cattle. The VetGun lets you remotely treat cattle with effective parasite control, so you can do it just walking among the herd. It's that simple. The proven topical insecticide AML VetCap is used with the VetGun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. VetGun. Check with your animal health supplier for availability.
Beef producers asked for it, and the wait is over. Enroflox 100 Enrofloxacin from Norbrook, now approved for single-dose treatment and control of bovine respiratory disease. With the same active ingredient and dosing regimen as Baytril 100 in beef and non-lactating dairy cattle. Choose Enroflox 100 when looking for an injectable antimicrobial solution to treat and control BRD. Observe label directions and withdrawal times. See product labeling for full product information, including warnings and precautions. Consult your veterinarian to see if Enroflox 100 is right for your cattle.
This hog is Hanover hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Mike Apley here at Kansas State University's College of Veterinary Medicine, talking about BRD treatment. And we kind of hammered on work with your veterinarian, identify cattle early, set up criteria on when you're going to treat them, one antibiotic, single dose, sub-Q, and then we get to the question, what else do we give them?
Time.
Time's a good answer.
But that did remind me of one thing,
okay.
The post-treatment interval, when you give that single injection, you've really got to have a plan for how long it's going to be until you say, are they better or do they need another treatment? And the data's starting to look like that week to 10 days is pretty much the magical spot.
And that's what, when I was in practice and still do some consulting, our treatment interval from first treatment to an animal that is going to need a second one is 11 to 14 days on average. And that's looking at millions of cattle, And so when you're looking at that 7 to 10, even regardless of a 48-hour, the ones I treat day 1, day 3, day 5, I don't buy a big bag of feed for those.
No. Yeah.
Those are checking out.
You can tell where they are, yeah.
So good treatment interval, 7 to 10 days, depending on the types of drugs of when we're going to reevaluate, but do it consistently.
Yeah. So back to your original question.
Yeah. What else are we going to use?
And I still struggle for any evidence. Every year, we talk about thinking about this fall and what's going to happen. I'm still struggling for evidence that putting anything with that antibiotic helps us in long-term recovery and getting that calf back to being a productive animal.
And so we're talking about B vitamins, and folks, we're talking about, when we say ancillary therapy, we're going to give the calf an antibiotic, but we're also maybe going to treat him with something else at that point in time. And I'm with you. I haven't seen anything yet that says that treating with, whether it's B vitamins, IBR vaccination, vitamin C, Banamine or flunixin, meglumine, what else? Dexamethasone.
Yeah, dexamethasone especially. I think there's pretty clear evidence we can do some harm with that one. Definitely some harm besides just not making an outcome difference. And
because of the immunosuppressive actions.
Yeah. And as a matter of fact, dexamethasone in cattle is used as a research model to shut down their white cell function. So,
well, I think the big thing is, and we've got to wrap up, but closing comments, BRD?
It's pretty straightforward. Case definition, do it consistently so you can have some records you can evaluate, pick one antibiotic, get with it.
Work with your vet.
Work with your vet. Yeah.
Well, thanks for being here.
You bet.
It's always great to have Dr. Mike Apley from Kansas State University's College of Veterinary Medicine. And thank you for watching DocTalk. Remember, always work with your local veterinarian. And if you want to find out more about what we do at K-State, you can find us on the web at www.vet.ksu.edu. Thanks for watching DocTalk. I appreciate all that you do, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.